So hello, everyone. We have today a great guest, Suzanne Gravel-Joss. And on the panel, we also have Dr. Lavonya Douglas from Unregulated Leadership and also the CEO of the Lionheart International Consulting. We are going to have a great conversation about what is it to be a leader in the healthcare field. So once again, thank you for your attention. And without no further ado, I would like to introduce my Dr. Douglas to, present her salutation to our guest, and then we will dive in.
Well, Sue, thank you so much for being here. We really appreciate this conversation. Like, we're super excited. We like to interview people from different spaces and different organizations and companies, and especially people that have started their own thing. Because a lot of times we work in a world where people just go to work. They go to work, they get a promotion, they, do what other people tell them to do because that's what we've learned to do, right? So there are a few people that start their own businesses, something that they're passionate about, they want to give back to. And so we really wanted to just kind of hear from you and how you got started and all the impact that you've made in the healthcare field. And so thank you so much for joining us. And we will get
Thank you
started
for
with
having me.
asking you some questions. Thank you.
Yes, thank you so much. Before we would like to just tell our viewers that this is almost the end of our series in this semester. We are interviewing Suzanne Gravel-Joss. She is the CEO of Brockton Neighborhood Health Center. So we have the honor to have her today. Not only she is also a leader in the community, but I'm also working as a mental health clinician in the pediatric clinic at this center. So it is really with great joy that we are welcoming Suzanne Gravel-Joss today with us. And she has many, I will say, titles and credentials that we can dive in. She is, but one thing that we notice about her resume, her bio, it's really like it seems that she's a visionary. She always wanted to work in the healthcare system. When I look at her bio, coming from an employer manager to the CEO for 30 years at Brockton Neighborhood Health Center, we kind of see that she has a vision. So I would like to invite Sue to tell us more about this vision. If she doesn't have anything to add to this presentation, I would like my viewer and her to let us know that why did she choose to be a leader in the healthcare community?
Thanks, Maria. I would say the vision is the vision of all community health centers, I would say. So I think, my goal was not just to work in the healthcare community, but to work in community health, where we're providing care at the preventive and primary care level with a vision of keeping our patients healthy and out of the hospital as much as possible. And I think also specifically the vision is to serve and care for low-income, diverse patient populations that might face barriers to care in other settings. So we, for instance, have about 2/3 of our patients who need interpreters when they come for their visits. And that's difficult to find often in other settings. We also have about 1/4 of our patients who are uninsured. So providing care to a group that really doesn't have other ways to access care, I think, is the vision in particular.
Yeah. Yes, thank you so much. So it seems that for you, compassion was always there because You could have so many other careers, but you choose to start. I kind of see also that you start small. So you weren't, probably, tell me if I'm wrong, you weren't scared to bring your own self into this vision, right? You started small. Can you tell us a little bit about the challenges? Along the way, there's always challenges, but
Sure.
I may think that, the beginning, or did you build this, nonprofit organization? What was the challenges? What was the passion? What was, the motivation?
Sure. So when I was hired by Brockton Neighborhood Health Center, they weren't open yet, and they had been
Mhm,
trying for about 4 years at that point to get open, and then we're facing a lot of public opposition that
mhm,
really was based in bigotry and
mhm,
racism and not wanting to serve
mhm,
low-income people in the community. So
mhm,
it had been a really long battle for the board and the prior director,
mhm,
even at that point. And when I was hired, we had 6 weeks to get open or we would lose our federal funding,
mhm,
because they had been holding on and holding on and holding on. So the challenges early on were really just getting it going. We opened in a church parking lot in a mobile van, because we couldn't get zoning to open in a building.
mhm,
And then really, I had to go before city council and the mayor, and finally we're able, just in the nick of time, we opened with, I think, 2 days to spare on our federal deadline, in the van. So that was part of the early challenges. Over the years, there's been just so many challenges, but a lot of it related to really rapid growth, and lack of funding. So we had to always just stretch every dollar, to provide the most care we could. And then I'd say most recently, a lot of the challenges is that Brockton Hospital closed due to fire, almost a year and a half ago now. And the other hospital in Brockton is a Steward Hospital, which is under, just filed for bankruptcy. So, and there have been major practices in the Brockton area close in the last year. So I would say the current challenge is really around access to healthcare and making sure we're doing our best for our patients,
mhm,
in spite of the fact that there's just not enough capacity in Brockton to care
mhm,
for everybody right now. So that's
mhm.
the big challenge.
Thank you so much. So as a resident in Brockton, um, I wouldn't imagine, the resistance that you faced at the beginning, because as we can see now, Brockton Neighborhood Health Center is providing great services to the community, people coming all around to come to Brockton neighborhood. So it was really a needed service to the community. And then providing not only great services, I could say, because I'm always surprised to see, because where I'm working, it's a very integrated system where that we have like a team of providers, targeting the needs of the patient. So it is really a great system, and I would like for that to be implemented elsewhere. Because as I said, my kids now are growing up, and I rarely had this model to, for a patient to be taken care of holistically, I will say. So because there was resistance, now I think we are at a point that you can say, okay, when I'm looking back, what did I accomplish? Where I'm at right now? So tell me a little bit about where you are at right now, and if there's more that we can expect from your leadership.
So I would say where I'm at right now is, um, I am retiring in March.
Mm,
So I think succession planning and really getting ready to leave the organization in great hands has really been a top priority over the past year or so. I actually gave 3 years
mhm,
notice, so gave us a really long runway
mhm,
to develop and prepare the next CEO, who will be
Mhm.
Dr. Maria Celli.
Mhm.
And so thinking through where I'm at right now personally is thinking about what I want to do after I retire
Mhm.
in March. And I do want to stay in the health center movement, but I
Mhm.
at the point that I don't want to work full time anymore. So
Mhm.
looking at potentially doing some interim assignments for a few months at a time, or working on some projects for the health center.
Mhm.
Uh, so
Yeah, that's big news.
yeah,
We know Dr. Shelley very well, so we know
right.
that you will leave this the center in good hands.
Yes,
But for you personally, if you look at the amount of work that has been done for 30 years, so you gave the center your life for 30 years.
right.
What are the most rewarding moments in your journey of being a leader at this center?
I would say some of the major openings of different departments and services were
Mm-hmm.
the highlights for me. So most recently, a couple years ago, during the pandemic, we launched a mobile substance use trailer where we're
Mm-hmm.
providing care out in the community
Mm-hmm.
at hotspots where the overdoses happen. So that's been
Mm-hmm.
a big one. Um, and over the years, as we've opened our site at the homeless shelter, we've launched vision services, dental, all of the services that our patients need and rely on. Each one of those was a really big event
Mm-hmm.
because it's not easy to launch a whole new service. And then the capital projects as well. So the main building for the health center took us 7 years to get approved and funded. And then, we're still
Mm-hmm.
out of space. We opened the pediatric site where you are
Mm-hmm.
attached to the Sensei supermarket. And
Mm-hmm.
that was a partnership that we had with them to open a grocery store in a food desert,
Mm-hmm.
and then have a teaching kitchen on our side so that we could teach our patients
Mm-hmm.
healthy eating habits, and then actually take them over to the market to help them shop.
Mm-hmm.
And it's a Cape Verdean market that has foods from all over the world. So
Mm-hmm.
we're able to teach our patients um, how to use some of their own recipes in a healthier way and what ingredients they could switch to be healthier. So I'd say that was a really big one. And then of course, COVID. We when COVID hit Brockton, it hit Brockton hard, and there was no director of the Board of Health in Brockton at the time.
Mm-hmm.
The prior director had died about a year before the pandemic hit, and they hadn't replaced that position. So we worked with the mayor and set up um, really daily meetings, and served as his public health advisor through the early stages of the pandemic. And he had only been in office
Mm-hmm.
about a month when the pandemic started.
Mm-hmm.
Wow.
So, yeah, so the public health infrastructure in Brockton was really not there. So we took on that role while he was bringing on staff into that department and set up. We became the testing site. We became basically the COVID clinic for the community. We did, massive testing, massive vaccination. We had the National Guard working with us, and really hopefully saved a lot of lives. Brockton
Mm-hmm.
lost a lot of lives as well, but I think we saved a lot by jumping in quickly and really filling that gap.
Yes, yes. I'm not sure, Dr. Douglas, if you have a question, but
Yeah, so I
I
was
would, yeah.
just thinking, and that when you mentioned COVID and the shift, right? Like it's almost like in that moment, that's
Mm-hmm.
when leadership shows up, right? In
Right.
crisis, right?
Mm-hmm.
And then
Mm-hmm.
figuring out where your expertise aligns and where you um are put in the places to be able to do what it is that you do, right? So your focus might have been on all these other things, but in a second, it
Exactly.
completely shifts to something else because that's where the need goes. And then having the right people in the right place. You talked about succession planning earlier and
Mm-hmm.
preparing somebody over these last 3 years to take over that role. And I think that is beautiful because a lot of times we don't prepare people for the positions that they go and we just put them in there and they got to figure it out
Mm-hmm.
once they get there. So one of the questions I have is, how do you develop your leaders, and how do you put people, because I believe putting people in the right position, not just filling a position. And so how do you in your organization make sure that you're getting the right people in the right position that have the passion for the things that they're doing?
I would say a big piece of it is that we almost always promote from within, you know, as we grow into leadership positions. So it does give us the time and the leeway to really develop the skill set that people need for the next step. You know, so Maria Celli, for example, my successor, was hired by the health center as the director of social services. She's a psychologist. Um, when our chief operating officer retired mid-pandemic, Maria was the obvious choice, so we moved her into that role. And then as I hit my 3-year, you know, notice and plan for retirement, we created a new position called deputy CEO to move her in and moved her into that, to really free her up to learn the position, and to
Mm,
take on special projects, that kind of thing. So
mm,
we're doing that at all levels at the health center. We have career ladders in all levels, of most positions in the health center. So for instance, we have for a medical assistant, one of the most entry level positions, there's 3 levels. And at the same time, our HR staff and their supervisors are coaching them to what's beyond that, which often is going to nursing school. And then the nurses are going to nurse practitioner school. And our director of nursing started with us as an LPN, and moved
mhm.
up through the ranks over 10 or more years. And so that's the typical story at the health center, is that, you know, we're trying as best we can, um, to avoid hiring from the outside if we've got
Mm.
candidates that we can bring along, internally.
That's awesome. That's
Yeah,
really good.
that's awesome. Yeah. And then it seems that this, I will say, the center values um long-term standing, okay? Long-term standing, and then commit to just um move up people from the ladder from top to bottom. So as I'm hearing you, it seems that you're saying that we are looking and we are like, not only building up, but you're also encouraging people to just stick with us, and then promoting, promoting on the long way, which is very important. um, which is very important. One of the questions that I would like to ask you, because it seems that for you, success is not only hard work, commitment, and also vision. So as a female leader, how was how was it? Because I'm seeing you as a very calm leader. It seems that you're not making too much noise, but you are leading anyway. You're leading anyway. And then you can see the small touch there. This is from Suja. You can see that. So how did you navigate, or what are the advice you can give to someone, also can give to us, our viewers and the panel, as female leaders, as leaders, right? Because you know that I think we are different. And then, the book says it, that we bring ourselves um, everywhere we go.
Mhm.
So tell us a little bit about, are you able to lead calmly but surely this big boat called the Walked Neighborhood Health Center?
So, I mean, I think the calm part is just my nature, so I'm not sure I have an explanation for that.
Mm-hmm.
Um, but I think as a woman, one of the most important things is
Mm-hmm.
just, persistence and realizing that, we have more of a balancing act a lot of times than our male counterparts, because we're also the leaders in our households.
Mm-hmm.
And if we have, you
Mm-hmm.
know, children and all of that, we're still
Mm-hmm.
expected to be the primary caregivers a lot of times. So,
Mm-hmm.
you know, I would say some advice is to find a balance, with your partners at home, and really,
Mm-hmm.
insisting that you know, that they take their share as well. And luckily I have a husband who does that, you know, kind of automatically. So I think that's a big thing. And I also, you know, I guess as far as how women leaders are perceived, I think in health centers, more than half the leaders have always been women. So I think we may be in an industry that's not typical of challenges that women have. When they're moving into leadership, about 85% of our staff at the health center are women. So I think that barrier is just not there, and I'm not sure that there's anything we can do to create that. It's just that that's what the industry is. So, but the good piece of that is that does create lots of opportunities for women to move up in the organization and in community health centers in general.
Wow, thank you so much. So those are best advice, not only for us, but also for the viewers, that you are leaders everywhere you go. You are leaders. We are not gonna keeping you long. I know that your time is precious. We were very pleased to have you. Dr. Douglas, do you have any words before I conclude with our always questions at,
No,
you know, for the end out?
yeah, I just appreciate you coming and
Yeah.
shedding some light on some things. You made a point about having a supportive husband. But I think family is also what matters and what makes
Yes.
women that are in leadership even better leaders because they have that support system at home that understand the day-to-day of what they have to do, but also support them in the role at home. So I think that's an excellent point. And so who you surround yourself with at work and at home matter for your own well-being because as we're always pouring into others, we also need people to pour into us as well. And so great point. Thank you so much for coming. It was a pleasure meeting you. And yes.
Yes, before you left, I think it was a great conversation. We had a lot, our viewers and ourselves had a lot of, insight from this conversation. Not only your trajectory as a leader, your your persistence, as you said, for you to be persistent in everything you do. That's great advice. Before we left you, I would like to ask you a question that we always ask any guest in our panel. It's really like, what makes you an unregulated leader? What makes you an unregulated leader? As we know that leaders, as you said, we can be a leader at home, in our community, in any setting that we can be, obviously. We would like to, for you to tell us, for you personally, what do you think? What do you think about being an unregulated leader?
I think for me, in a lot of ways, that means being really nimble. And not clinging to things that aren't working anymore, and really being really to jump in with creative ideas. And I think back to one example from the pandemic when supplies were really short and we ran out of hand sanitizer. So we had our facilities director go down to Rhode Island and buy 39 bottles of moonshine and take it up to a compounding lab up in Methuen to make their own hand sanitizer for us out of moonshine. So that kind of thinking of how can we resolve problems when there doesn't seem to be an answer? And I would say that the piece of being unregulated is just really speaking up, being the voice of the patients, because often they don't speak for themselves. And this has been particularly critical right now as the state has launched incident command around the Steward bankruptcy crisis. We have the other hospital closed due to fire. And I have been very loud and very persistent at the state level in telling them what we need in Brockton to do the best we can to care for our patients, given that pretty dire circumstances. So I'd say just being really, really vocal on behalf of the people you're serving.
Well, thank you so much for sharing. I think that we can just sit down again and talk for a long time because there's so much we've learned from you. I will say my take is that persistency and also being innovative. Don't be afraid to just see bigger The
Mm.
long, I will say yes, yes, don't be afraid. When we think about like this example of, or people were able to just, think out of the box
Yeah.
and do something differently. The COVID taught us that. And I know that and I know that Dr. Douglas and I will probably, probably meet with you, talk with you. I personally thank you for all your service, all your hard work, and really all your compassion for our Brockton residents and probably other residents, because I can see people from all over the place coming to the center. Thank you again for giving us this time, to not only talk with us, but also to talk with our viewers. We wish you the best in anything else that you have in mind to do. Thank you again, Dr. Douglas. Thank
Yeah,
you.
thank you
You
so
have
much
the
for
last
joining.
word.
Thank you for joining us. This has been a great conversation.
Yeah.
And I wish you well in retirement because that sounds exciting.
Yes.
Okay.
Thank
Well,
you.
thank you for having
Bye-bye.
me. It's been a
Yes.
pleasure to talk to you.
So,
All
Yes. Thank you. Bye-bye.
right,
Thank
bye-bye.
you.